thank you for joining us today. Absolutely love the opportunity to know that you're there and to share a couple of things that I hope will be helpful to you as members of PHP. We've got a great team, and it's a real honor to work with them on your behalf. I just want to get started by talking a little bit about what insurance is. And the way to think about insurance is that it's a contract, and it doesn't matter what kind of insurance policy you have, whether it's for your car, whether it's medical, or any other kind of insurance. The basis of that insurance coverage is a contract. It says what is covered and what's not covered. And when it comes to health insurance, that's reflected in something we call the master policy. Now, I wouldn't suggest that anybody, take the master policy as if they're trying to read something that's exciting and fun. But it is a document that's really important to understand what your rights are under the insurance contract. In addition to the master policy, we have grids and we have other things that you can look at to better understand your benefits. But I just want to start today's discussion by helping you understand this idea of coverage as a contractual issue that is contained within this document called master policy. In addition, when you think about coverage, it is the combination of a couple of things. First and foremost, your employer is the one that largely decides the kinds of benefits that you receive, especially when it comes to what your deductible is, what your copays are, and different things like that. There's also specific benefits that may also come into play here. So know that first and foremost, as PHP approaches the idea of coverage, it really is a collaborative effort with us and your employer to determine what it is that would be best for you in terms of coverage and cost and those kinds of things. In addition, there's state and federal law that talks about what has to be included as part of insurance. There's also industry standards that develop over time, as well as PHP policies. And so again, the concept here is that insurance is based on a contract, and that contract provides this range of services that you receive. And that when it comes to what goes in that contract, that master policy, it involves everything from the direction of your employer to PEHP policies. Next thing I wanted to kind of dive into a little bit is the idea of cost sharing. And by cost sharing, I mean money that comes out of your pocket to pay for your health care. There's the first way to think about this is the money that comes directly from your paycheck. We call this the premium. There's a cost for insurance. And I know the state plan better than most, and I know that in the case of the state, 92% of the premium is paid by the employer, and 8% comes out of the employee's paycheck when you're dealing with the traditional plan. It's important to think of it this way in terms of this is a cost that comes out every paycheck, regardless of whether or not you use insurance or not, and that for the vast majority of cases, the vast majority of the cost is paid by your employer. The next thing that we have when it comes to cost sharing is out-of-pocket payments. You only have an out-of-pocket payment when you have a medical need and you receive services. And when that happens, there's a couple of different ways that this happens, and a couple of different ways to think of this. The first thing is that we have something called a deductible. And a deductible is the point in the plan where you're responsible to pay 100%. And so if there's any kind of medical expense, it's before the deductible, you will go ahead and pay that. Sometimes we'll have copays if you're again on a traditional plan, and I'll explain a little bit more about traditional and HSA plans here shortly. But a copay actually comes before the deductible. And in the case of like a doctor's visit, that copay may be $25. If you go to a value provider, it is generally $10. So you've got your deductible. You usually pay 100% unless you're on a traditional plan, and then you have a copay for certain services. And then once you meet your deductible, we have something called coinsurance. And this is another a way of thinking about cost sharing. And as I talk about cost sharing going forward, I'll mostly be talking about that. And what this refers to is the idea that once you've kind of gone through your deductible and we get into the sharing period, you'll pay 20% of the medical expense, and PHP will pay 80%, generally speaking. Some of you might have 90-10 or something else like that, But the concept is exactly the same, and that is that after the deductible, you share in the cost with PHP. Finally, there's times when you won't pay anything. Most common time is when you have preventative care. Preventative care is something that came as a result of the Affordable Care Act back in 2010, and it largely involves things like your annual checkup. There are times when you may think that something is about kind of your annual checkup, it's a preventative kind of service, when in fact it may not count as preventative because you're seeking some kind of treatment. But preventative things include, that annual visit, colonoscopies, unless again you're doing it for treatment, and other things associated with that, including the cost of chronic medications. In the case of chronic medications, you'll still have to pay your deductible, but it'll come before your deductible. You'll still have to pay for your cost sharing arrangement on that, but it would not be subject to deductible in most cases. Lastly, you pay nothing when you've reached your maximum out of pocket. It's really important to understand this as a concept. If there's nothing that I share with you today that hopefully brings a little bit of comfort to you, hopefully it's this, and that is that if you've never had a really serious health condition and you've never needed to worry about reaching your maximum out of pocket, this is there to make sure that you know that there's a cap on how much can come out of your pocket in any given year. I always think about this concept when I had a good friend of mine who was diagnosed with cancer years ago, and was just absolutely, man, he was facing the crushing blow of getting the diagnosis. And then he was thinking that he was going to just have to pay astronomical amounts of money in order to stay alive, frankly. And in that case, I remember sitting down with him and looking at his policy and saying, well, let's look at your maximum out of pocket. He says, I'm not sure what that is. And I looked at it. I can't remember what the number was, but it was maybe $5,000 or $6,000. And what I was able to tell him is that at the end of the year, well, at any time during the year, if you reach this amount out of your pocket, you won't have to pay any more. And so when you think about the maximum out of pocket, anything you've paid toward the deductible goes toward it. Anything you've paid toward copay goes toward it. Anything you pay in coinsurance goes toward it. Clearly, when you're paying your deductible, that goes fast because you're having to pay 100%. It goes a lot slower in terms of counting up towards your maximum out of pocket when you're paying either 20% or 10% in coinsurance. So this is just kind of a visual that hopefully gives you some idea of kind of what these stages are. Again, thinking about the deductible as it's 100% your responsibility, kind of the sharing period in which you'll pay 20%, the plan will pay 80%, and then maximum out of pocket, which means when you've reached that, the health plan pays 100%. So maybe just moving to the next concept is payment terms. So we've talked a little bit so far about the idea of coverage that's kind of limited within this contract and how it comes about. We've talked a little bit about how you have expenses both out of your paycheck and out of your pocket. And now I'd like to just take a couple of minutes to kind of go through kind of the document that you get from PHP called an EOB, or an explanation of benefits, just to make sure that you have a good firm handle on what those terms mean. The first thing that you'll see on the bill at the top of it is something called the billed amount. The billed amount is generated solely by the provider. All the PHP does is to restate whatever the provider has said. I will tell you that in a contracted situation, the billed amount has virtually no relevance, because the billed amount is not any amount that you have to pay. Instead, what's going to come into play is something we call the allowed amount or the contracted amount. The billed amount is only important in a situation where you've gone to an out-of-network provider, and so there's no contract that binds the provider to only accepting the allowed amount, which is the contracted amount. The second thing is that if you get some kind of service that's not covered by PHP, in that case, the billed amount can come into play as well. And so just recognize that those situations exist, particularly if you're going for holistic medicine or something like that. There's a really good chance that there'd be parts of the bill that would be paid by PHP and others that would not. to the extent that you can, you'll really want to make sure that you talk to the provider about trying to come to an agreement on price, so that you're not subject to that billed amount. And we'll talk a little bit more about that as we go along as well. So you got the billed amount, which is whatever the provider says it is. You've got the allowed amount, which is the contracted rate. Allowed amount is kind of a weird term. You've got to be an insurance person, but just know that that means the contracted rate or the in-network rate. After that, as you look at your bill or as you look at your explanation of benefits, you'll see reference to the paid amount, and that's how much PHP paid of the allowed amount. And so, clearly, if it's a situation where it's a copay, PHP is going to pay everything but the $25. You're just going to pay that $25 for an office visit if you're on the traditional plan. And then the part that you want to look at is your responsibility, and that's your share of the allowed amount. Again, I would just say a word to the wise, and we try really hard to never suggest that you should pay the billed amount, but be, if your responsibility ever suggests you should be paying more than what the allowed amount would be based on the allowed amount, I just think that it's really important to try to push back on that with the provider. So just a really quick example. So if the billed amount, you went to the doctor, was a specialist, and the billed amount was $500 and the allowed amount was $350, the first thing we all know is that the provider is going to write off $150. The next question that we have is whether or not you're going to pay that, you're going to share that with the health plan, or the health plan is going to pay 100%. So if this was before the deductible, let's say that you would be responsible for $350, again, assuming this isn't a copay situation, but it's just part of the deductible. If this was after you reached your deductible, you'd be sharing this at 80-20. You'd pay $70. The plan would pay $280. If you'd reach your max out of pocket, you'd pay $0. The plan would pay $350. The same would be the case if you're looking at preventative care. If this was a preventative visit, it would still be $350 would be the allowed amount, and the amount you would pay would be $0, and the plan would pay $350. Pharmacy operates very similarly. That there'll be a deductible that you pay that represent against, again, 100% payment on your behalf. And then you get into cost sharing arrangements, which can include tier 1, which are generally generic drugs. Those are $10 copay generally, depending on your plan. And I would just emphasize, maybe at this point and throughout the discussion today, that the things I'm talking about are general in nature, and that it's always good to look at your specific plan documents in terms of exactly what your tier is. It may be different than a $10 copay, but generally speaking, $10 is pretty common. Tier 2 drugs, 25%, tier 3, 50%. A lot of times there may be caps associated with those. And then we have specialty tiers as well. And just like medical, all of these things roll up into the same max amount of pocket. Next, we'd like to just kind of take a minute to review the kinds of health plans that PHP offers. The first is the traditional plan. And when I think about the traditional plan, the thing that comes to my mind is this idea of paying up front and going from year to year. So what I mean by that is that you will pay more in premium, generally speaking, in order to have a traditional plan. And so it means that regardless of whether or not you ever use your insurance, you're going to pay a higher amount so that if you do need insurance, you'd pay less out of pocket. Okay, higher premium, more out of your paycheck, but then less out of your pocket if you need healthcare services. So because you're paying a higher premium, there's lower deductibles. Also, there's copays available that you would not have on an HSA health plan. The other thing that's interesting, and this may not apply to all plans that PHP offers, but often there will be an individual max amount of pocket. And what this means is that if you have one member of your family with high healthcare needs or healthcare costs, that it's like you have different buckets for every member of your family. And for example, in the case of the state, once you reach $3,750 that you've paid for this individual, then you've reached your max amount of pocket, and you wouldn't have to pay any more for that individual. If you had other family plan members that still had expenses and hadn't reached the max amount of pocket for them individually, or that you hadn't reached it as a family, and I'm pretty sure it's $9,000 for the state, you would still make payments on behalf of those individuals, but not for the person who'd met their maximum out of pocket. It's also really important to know that under federal tax law, that there's a device that's available both for traditional plan and a different one for HSA plans that allow you to essentially take money from your paycheck and put it through these accounts, in this case a flex account, that gives you tax benefits, so that in putting this money in your flex account and using it for healthcare, you don't have to pay taxes on it. Flex accounts have limits to them in terms of the amount that you can put in. It's also not anything that anybody else can contribute to it, unlike the HSA account that I'll explain in just a minute. And the other thing that's really important to understand about your flex account is it's use or lose. So if you put too much in, you will forfeit that money, and that's why a lot of times you'll see a lot of advertisements toward the end of the year where people are saying, make sure you come and get your glasses or come get LASIK done or those kinds of things. The second kind of plan that PHP offers is what we call our Star HSA plan. And the way that I think about this plan is that you pay as you go, and then you save what you don't spend. So rather than paying a set amount or a higher amount in premium, you pay a lower amount in premium. And because you have a lower premium, it means you have a higher deductible, which means that for longer periods of time, you're going to have to pay money out of your pocket, right? And then once you do reach your deductible, then you will share 50, in co-insurance on an 80-20 basis in all likelihood. And also when it comes to the Star plan, there isn't any kind of individual out-of-pocket max. It's only a family out-of-pocket max. Again, for the state, this is $7,500 if you're a family. The HSA account, though, is much more flexible and has some other features that are really beneficial that the flex account doesn't have. First of all, both you and the employer can put money in. It can build up over time because it rolls over. You don't have to ever use or lose. In fact, I have quite a few friends that I know that actually put as much money as they possibly can into their HSA account. They never take it out for medical expenses. They really want to let it grow because it's the one account of all the accounts that are out there in which you can put it in tax-free. It grows tax-free, especially if you've invested it, and then you can withdraw it tax-free for medical expenses. And then there's also provisions that involve retirement when you get to that stage. So at any rate, unlike the flex account, it can build up over time. And both with the flex account and also with the HSA account, it provides you the ability to pay for things that maybe don't come within the coverage of your contract, right? So, if I'm thinking about this for me, I'm thinking about, glasses, being able to use HSA money or flex money for that. I also think about LASIK, right? I might think about situations where maybe my employer has a limit of maybe 10 visits for chiropractic care. And in that situation, I have my flex money or I have my HSA money that I can use to purchase more benefits than what my health plan is giving me, right? I think that one thing that is really cool to think about, though, and hopefully makes you feel a little bit better if you're in this situation, is if you do have benefits that you really wish your employer would cover and they don't, to the extent you're on an HSA plan and they've given you some money, it means that you can use that employer money for virtually anything that comes within healthcare and that is authorized as an eligible expense under federal law. And it is quite broad. And so rather than trying to get your employer to change it, it's like you have this pool of money that you're able to kind of use as you see fit. I think that that's a valuable part of thinking about it. Another important thing about an HSA is that if you're willing to take the premium you would have paid and you put that into your HSA account, right? It's like you can do some really good things. Let's say that you would have to pay $1,500 in premium, right? And you took that, and rather than putting that into premium, you actually put it instead into your HSA account. And then the way to think about it is that as long as your medical expenses came below, let's say it was $1,500 in savings in premium and $1,500 in employer contribution, as long as your medical expenses came below $3,000, you would have money that you didn't spend, right? That you would have spent otherwise, right? I suppose. And then you put that into your HSA account, and then it's there for you in future years. One of the strategies that I think is also good to think about when it comes to HSAs is if you can build it up to what your maximum out of pocket is, you're really in good shape, because then you know that you have no out-of-pocket expenses. Even though you have this high deductible, you know that you're protected against a really tough year if you've been able to build up that HSA to meet your maximum out-of-pocket. So just another visual in terms of how to think about this, right? You've got employer contributions coming in, you've got employee contributions, and then you pay those out. And as you pay them out, you'll be paying 100% for deductible and 20% for coinsurance. Next, we'd like to move into the idea of networks. To this point, we've talked about what is part of insurance. We've talked about what comes out of your pocket. We've talked about plan design, and plan design is purely about how much comes out of your pocket when you have healthcare expenses, right? How much do you pay up front in premium? How much do you just hold back in your HSA account? When you think about plan types, it's all about your benefit and how it impacts your out-of-pocket expenses. When you look at networks, that's not about your benefit. It is about who you can go to in order to get the benefit of the allowed amount, the benefit of the contracted amount, okay? Because anybody that's in network, it means that as long as it's a covered service, you will never have to pay the billed amount. You would just have to worry about the allowed amount. So we have two healthcare systems essentially in Utah, or two networks is probably a better way of saying it. The first is the Advantage Network, and this is based on Intermountain hospitals along the Wasatch Front. And I think the way, at least the way I think about the Advantage Network, is that it provides integrated care in the sense that, it's all within one system, hospital system when it comes to the Wasatch Front. It's important to underscore that when we're talking about Intermountain hospitals, we are talking about the Wasatch Front. If you live in a rural area, all rural hospitals will be on the Advantage Network, and same for the Summit Network. And both with the Advantage Network and the Summit Network, we have a broad range we have a broad physician panel. When I think about the Summit Network, the word that pops in my mind is options. And those options include both hospitals and other facilities. And so it includes Mountain Star Hospitals, Stewart Hospitals, the University of Utah, both its clinics and its facilities and those kinds of things. And then also freestanding facilities. Freestanding facilities are those that are not connected to a hospital and that charge, maybe a quarter to a third as much for certain procedures, right? You can't do everything at a freestanding facility, but there's a lot of things you can do, MRIs, knee scopes, those kinds of things. And so within the Summit Network, there's a lot of options that include both hospitals and also these freestanding facilities. As I mentioned already, it includes all rural hospitals and also has a broad physician panel. So just to kind of review quickly, think about your insurance as two things. What's my plan? Meaning, what's the philosophy behind how I pay for my healthcare, right? Do I pay up front or do I pay as I go? If the traditional plan, you're paying up front, and your network options would be the Advantage Network or the Summit Network. And this applies to most all of our employer groups. They offer both networks. Some only offer one or the other, but most offer both. And then the Star HSA plan is also going to be coupled with the Advantage Network or the Summit Network. Next, I wanted to move into the idea of helping you avoid surprises. I will tell you that for at least a decade, our number one, well, it's probably 1A. Our number one thing is to serve you to the very best of our ability. We take that very, very seriously. And it's kind of why we do these kinds of things, and why, you get to the end of this, and I'll give you my email address and my cell phone number, and Joel will do the same. We really want to serve you, and that's probably the first thing. But the second thing we know that's really important to you is avoiding surprises, right? That healthcare is expensive, inflation's high, all these kind of things are always kind of at the door a little bit, and getting a surprise in healthcare is the last thing we want you to experience. We do our very best to eliminate those. I will tell you that there's things that can be very difficult for us to manage, because whatever your doctor or your dentist or any other provider recommends in their office, that really is between you and the doctor or dentist or provider. And if you decide, you can get uncovered services. You can go out of network. You can do all these kinds of things. We never want to restrict you from doing that, but at the same time, those situations can cause some issues. So the first thing, just to kind of focus on for just a minute, will be out-of-network providers. I'll take a little bit of time to talk about that. The failure to get pre-authorization, we'll talk a little bit about that. Non-covered services is where a provider doesn't provide, there's something that doesn't come within the contract. I'll give it just a quick example, just because it happened this last week. Is we had a provider who's a dentist that was providing a kind of a mouth guard of sorts that helps you if you have sleep apnea. The allowed amount, and you know what the allowed amount now is, was $900. And this came outside of the contract situation with this provider. And so they had the ability to balance bill the member as a non-covered service, and they billed the member $8,500 for the appliance, and then put in another $1,500 for the service. Clearly not a good situation. And so, whether it's an out-of-network provider or something else like that, we want to protect you so that you don't have to ever worry about that billed amount. Treatment limits can also come into play that can be surprises for you. I'll talk a little bit about that, particularly with chiropractors, and then excessive costs. So the good news, the really good news of this presentation is that the issue of emergency care has been solved for you and everybody else in America because of something called the No Surprises Act. It passed recently, and it went into effect in January 1. And essentially what it says is this: it says that if you go to an emergency room and you pay whatever you're supposed to pay of the allowed amount, your responsibility is what we kind of referred to a little earlier, that you're done then. You don't have to worry about anything. Because in that case, it can't be out of network. You can't be subject to the balance bill or that billed amount. So this applies both to hospitals in-state and out-of-state. As many of you, I hope, know, that it's always been possible to go to an in-state hospital on an in-network basis, even if they weren't in your actual network. That was something that was really important for us to protect you from a long time ago, and we've done that in-state. But out-of-state, it's been really hard to have that same in-network protection. So the Federal No Surprises Act takes care of that. What's really cool is that this act protects against hospitals, doctors, ambulances, and air ambulances. Honestly, in the state of Utah, we've been so fortunate because most of our providers will contract. And in other parts of the state, in other parts of the country, there's hospitals that won't contract for emergency care. There's doctors that won't. There's ambulances that won't. And for sure, there's been air ambulances, and we've had that experience here in Utah. And this brings a real peace of mind, I think, to everybody when it comes to emergency care. So know about the No Surprises Act. I don't suggest that you kind of go out of network for emergencies if you don't need to. If you've got an emergency and you can get to an in-network hospital, that's still going to be your best bet. But if you are like me and you're out of state, and I had a stingray sting me a couple years ago, and I was out trying to boogie board. At that moment, I'm thinking to myself, oh my goodness, where's the nearest in-network hospital? Because of the No Surprises Act, I can worry just about where's the nearest hospital, which is exactly what we would encourage you to do when you are out of state, just to go to the nearest hospital for emergency care. You don't worry about it if it's in network or out of network. The federal protection exists from the No Surprises Act. The second thing I would just say is that if you have a family member, or if you're like a gentleman that Joel and I ran into yesterday who's moving out of the state because they're retiring, right? So if it's you that lives out of state, or family member or whatever, and you need hospital services, your best bet is to call PEHP just to make sure everything's pre-authorized, everything is good, and also to make sure we get you going to the provider that's best for you. We have a provider directory. It's on our website. In the very near future, it's going to look just the same for out of state as it does for in-state. It has a ton of doctors on it. It doesn't have as many facilities on it because the facilities, unfortunately, haven't contracted as well as we'd like, but we have other means of making sure that we can place you in places that you'll have the complete protection against balance billing, everything you'd want from an in-network hospital. So just give us a call so we can make sure we get you to the right place. And then if you or a family member live out of state, use that physician directory that we have on our web site. It's got just a vast number of doctors, and we're good to go. I would just add one caution here. So there's no more cautions anymore with emergency care. There continues to be a significant caution if you are looking to go out of state for services. There are times when you need to go out of state. There'll be times we want you to go out of state, and we will take care of you in those situations. Make sure you get to the right place. We've got a clinical staff that's outstanding in terms of understanding, which providers provide the exact care that we need when it's not available in Utah. And that's the key. That's the crux, is that the cervix can't be available in Utah. If for some reason you really decide that you prefer to go outside of Utah for care, we can help arrange that for you, except when we pay, we can't protect you from balance billing, and we'll only pay you the out-of-network benefit based on what we would pay here in Utah. But we do respect your ability to have choice, and we want to support you in that. I wanted to just talk a little bit about the out-of-network benefit, because the most significant surprise you can have is based on a provider being out of network, and that provider turning around and wanting you to pay the full billed amount. From the very beginning, at least of my time at PHP, we have tried to really make this benefit as standard as possible. Not all of our plans have the out-of-network benefit, but the vast majority do. And with that benefit comes a couple of things. The first thing is that before the deductible, any medical expense that you have that you pay out of pocket for, that is going to be counted the same toward your deductible, whether it's in network or out of network. This is a big deal because when you are before the deductible, the only benefit that you really get from insurance is the fact that whatever you pay, if it gets paid, you want it to make sure that it gets counted towards your deductible. If it never got counted towards your deductible, then you would be paying out of your pocket forever. You would never have insurance. And so this idea of paying toward the deductible, crediting toward the deductible, is really important. It's also important to underscore that this is only up to the allowed amount. So if you were to go get a service done that's $350 and PHP only pays $150, we're only going to credit up to $150. We're not going to let you credit the $300 because that's more than what we would normally pay for. But still, it's pretty doggone good if you can do dollar for dollar up to that allowed amount. Also, so we do support your right of choice when it comes to things like CPAP machines and other things, right? And so if you decide to go and do something and use a non-contracted provider and pay completely out of pocket, we have a process where you can send us a reimbursement form along with the bill, and we can credit that toward your deductible, as well as if we're in the cost sharing period, share that with you, as well as if it's maximum out of pocket, we can pay you back 100%. But as you can imagine, because of this policy, if you are on the HSA plan, it essentially gives you the ability to treat in-network and out-of-network the same up to that $3,000 deductible. After the deductible, you pay 20% more. You pay 20% more in coinsurance than you normally would, and so if it's usually you pay 20%, that jumps up to 40%. But it's also good to know that kind of like a Christmas sale, that sometimes, the amount of discount isn't as much, it can say 90% off, but that's not as important as maybe the underlying price. And I'll give an example of that in just a second. And finally, if you've hit your maximum out of pocket, then what happens is that both your in-network and out-of-network expenses both go towards your maximum out of pocket. Not every plan does that, either for the deductible or maximum out of pocket. Again, we're not trying to penalize you when you go out of network. But also know that it'll also cost you more, so it'll cost that 20% more. So if you were hit maximum out of pocket and you weren't supposed to pay anything out of pocket and you went to an out-of-network provider, you'd have to pay 20% of up to that allowed amount. Okay, so I just wanted to give a real quick example of how there may be a situation where you might want to consider an out-of-network option. And so let's take a back MRI, and let's say that it's $1,834 at an in-network hospital. Let's say it's $333 at an out-of-network imaging center. Let's say that you're on the STAR plan, you work for the state, you've got a family, it's a $3,000 deductible, you haven't paid anything yet, and so this is your first expense, And in that situation, you would pay $1,834, preferably, hopefully, from your HSA account because there's money in it, or you'd pay the $333 because, again, both of these things are going to be credited 100% towards your deductible. After your deductible, if you're in network, you'll pay $367 because that represents 20%, and you'd pay $133 out of network at the 40%. And this suggests that you're able to get the payment at $333, right? And I'll explain that in just another minute of how you can make sure that's the case. So after your deductible, you would pay $133 at 40%. And then after maximum out of pocket, you've reached that. If you're in network, you pay $0. If you went out of network, you could pay $67. So hopefully you can see how this shifts and changes a little bit depending on where you're at in your deductible. So here's the caveat that's really important, and that is that if you're going out of network, you have to protect yourself. Out of network means there's no contract. No contract means there's no agreement on price. No agreement means the high risk of gouging. I just gave that $8,500 example. So your best solution is to do what you do in any other situation where you'd be requesting a service from a provider, whether it's a lawyer, whether it's a car repairman or car repair person or anybody else like that. And that is to get the price in advance, to have some idea of what the price is in advance. Now, when it comes to getting the price in advance, what really helps out is if you go and use PHP's cost tool. If you have access at open enrollment to both the Advantage and the Summit network, you can go on either one to use that to decide which network you want to be on. And you can also get an idea of what the cost will be as well if there's cost just associated with one of those networks. So that's what I would do is I would go online and I would see what the price is, and I would call up and I would say, hey, will you give me that price? I might even ask, would you give me a cash discount if I could get there too, I suppose. If you can't do that, the second thing is to do what I just suggested before the fact, but doing it after the fact, which means to, again, look and see what PHP's contracted rates are. You'll actually see the allowed amount again on your explanation of benefits, and you can use that as a way to tell the provider, listen, I know this is out of network, but this is the right amount. This is the industry amount. This is the market amount. This is the amount that you should take from me, and you shouldn't gouge me by charging me the billed amount. And in either situation, if you can ask about a cash discount, it certainly doesn't hurt. So I don't suggest this for everybody by any stretch, but just know that we have this out-of-network benefit, how it works. And so if in any situation it might work for you, that you know how it works. And particularly to, again, help you to avoid surprises. Some special problems with out-of-network. And I always feel so bad about having to say this because it seems so counterintuitive to any rational human being. But healthcare sometimes is not as rational as you'd like it to be. And that is because everybody has a different role to play in healthcare. And so in this case, your doctor may be the one that says you need some kind of lab done. Your doctor may be the one that takes your blood or other specimen from you. And then your doctor may or may not be the one that tests your specimen. They may send it to an outside lab. If they send it to an outside lab that doesn't contract with PHP, you've run into an out-of-network situation. The frequency in which this happens, I think, is really down quite a bit, but it still is possible. And so, as I approach this kind of situation, LabCorp and Quest, and if you're with Intermountain, if you're on the Advantage Network, the Intermountain Central Lab, are all in-network labs that you'd never have a problem with, right? But, if you can't remember that, all I would do is just say, is this lab staying in Utah? Or do you know where this lab is going? Or, anything like that that says, or have you ever had problems with health plans paying for your labs? Again, it doesn't happen a lot. And even when it does, usually the lab will just take whatever the insurance company pays rather than trying to hassle you over it. But this is a place where you can be surprised. Second thing is if you're going in for surgery or some other kind of procedure, you may be treated by physicians that you never have a chance to meet. And those are primarily what we call hospitalists, and they fall into primarily two categories. The first is anesthesiologists. The second is radiologists. And the anesthesiologists, their job is to come in and make sure that you're asleep during the procedure. Radiologists look at your imaging, your MRIs, CAT scans, and the like. And again, you can't choose them. You can't make sure they're in network. In that situation, my recommendation is just to say, hey, have you ever had any problems with your anesthesiologist or radiologist? I will tell you that we've had some unfortunate situations over the years with, providers that are hospitals that will not contract with any health plan. We solved all of those to the best of my knowledge, so you don't have to worry about it. But just a word to the wise, it doesn't hurt. Maybe the anesthesiologist is new in town or the radiologist or whatever. But just say, are there any problems with that? And that should at least give you some help on that if it were to be a potential problem. The next thing, again, just underscores exactly what I was mentioning with the labs, and that is you need to check both the place that you're getting care and the provider, particularly if you're looking at something at a facility. The facility is one kind of provider, whether it's a freestanding or it's a hospital. That's a different provider than your doctor or your surgeon, whoever it is that you're seeking services from, right? So you might have a provider that has privileges at every hospital in Salt Lake County, and so they're just going to think that, yeah, I can just take you to St. Mark's, when in fact they really should be taking you to IMC. So just make sure you understand both of those things, and it's really hard to expect your provider always to kind of understand that distinction. Then non-covered providers. We do have situations where we have essentially disqualified a provider from being from receiving the benefit of our out-of-network benefit, because our experience with that provider is such that it's just too hard, right? And we think that our members have been put at risk. So the most important one to know about when it comes to this are chiropractors. Chiropractors are great, very helpful, but they are getting more and more into holistic medicine, which I think is just perfectly fine for some people if that's what it is, but it's not within your coverage contract for the most part. And so if we've had trouble with chiropractors trying to bill us for things that don't come within the contract, we've essentially said, that's not good for us, for our members, because you're getting that full billed amount. So make sure that if you go to chiropractor, it's an in-network chiropractor, because we don't have an out-of-network benefit. This also is on our provider lookup tool, our provider directory. You'll see right at the bottom, it's got a couple of exclamation point marks by it saying, look here. I'll talk just a couple of minutes about pre-authorizations. My main message here is that they have a role to play, as much as I wish they didn't. And it all comes down to, what's medically appropriate, right? And so we want to make sure that the service that is being provided to you is clinically effective, that it actually has evidence behind what it purports to do, that it's appropriate for you as a patient, and it's also in the right setting. And so just a couple of really quick examples. Sleep study, is it a proven effective? Yes, it's accepted diagnostic test. If you have symptoms of sleep apnea, absolutely it's for you. But when it comes to the setting, that's where it can be challenging. 84, 86% of sleep studies can be done at home at a fraction of the cost of what it costs in a hospital. The hospital has a role, like hospitals have a role in just about everything, but it's not for situations where, you don't need it, right? You don't go to the hospital, with, if you've got a cold or something like that, right? So the hospital setting is only appropriate if they're something called comorbidities, which means, other serious healthcare conditions. So in this situation, we need authorization to make sure that you get to the right place. Genetic tests is another area that's important to know about. Is it proven effective? Well, in this case, it's kind of conditional, right? It's only if treatment is possible. There's a lot of important concepts in healthcare when it comes to what's part of this insurance coverage. And one of those is this idea that treatment has to be involved. Treatment has to be involved. There has to be something about your condition, your situation, in which treatment can help you out. And if it can't help you out, then it comes outside the contract, right? So when it comes to genetic testing, its purpose is to help confirm whether or not you have a particular genetic mutation, and that mutation may result in a particular kind of disease, that it elevates the risk of that. If it tells you about something, a condition in which, again, number one, there's really no health problem associated with or health treatment associated with it, then it doesn't make a tight enough connection with the health plan. So proven effective, it really depends on what kind of test you're talking about. This patient, we want to make sure that we've exhausted other means of diagnostically testing you, and wanting to make sure that your history supports it. And then also on this one, preferred setting, we do have a preferred lab that we use, and it provides excellent service and the appropriate discounts in an area that can kind of get a little crazy. Inpatient care also can be an area where we would have pre-authorization. Is it proven effective? Yes. In this situation, the challenge is that at some point, unless you're going to live in the hospital, there's a time when your condition is improved sufficiently that you need to come out. And so we work with those hospitals when we have to, in appropriate circumstances, to make sure that you're not staying in for an undue period of time. We have all these different things in place to help step down and whatnot. But this can be a real problem. We actually had, this was on our Medicare sub policy a few years ago, where we had a provider who kept somebody in a hospital setting for 150 days longer than they should have. Not a provider that probably anybody knows off the top of their head. But as a health plan, we run into these situations, and as you might imagine, it only takes one experience like this in order to really try to tighten up controls to make sure that it doesn't happen again. Okay, so just to kind of summarize, I call these canned questions, in terms of ways that you can avoid surprises by, if it's something a little different, asking, is this covered by insurance? I've got the best dentist on the planet, I think, but there are things that he provides that are not covered by insurance, and he's really nice about telling me when that is. And when that's the case, I ask him a lot of questions that I'll talk about in just a minute to make sure that it works for me as a patient, right? But ask about that. It's covered by insurance. Chiropractors and some others in holistic medicine may be the same. If you go to an ophthalmologist, that may be the case that we get to LASIK, that's not going to be covered, and they can help you on that. Asking if it requires pre-authorization, the doctors have a really pretty good feel for that. If you have any concerns, just give us a call and we can give you that peace of mind. The vast majority of things are. In fact, if you go to our cost tools, you'll see what requires pre-authorization and doesn't in a lot of places on our tools. And so we've tried to help you out there. And then, try to make sure that you only have in-network providers so that you get the benefit of that allowed amount or that contracted rate. I also think it's important as a patient to make sure that the doctor, the system is kind of working for you, right? And so I'm a lawyer by background and practiced law before I came to PHP. And the thing that I enjoyed most about being a lawyer is the fact that I represent clients. I don't ask clients to be an extension of me. I see my role as being an extension of them. And so I loved getting to know people and what their situation was. I did my best to advise them from cliffs. I mean, if they were going to do something that didn't make sense, I certainly want to kind of pull them back from that. But I think doctors are the same way. They really would like to know your preferences, your values, your concerns, those kinds of things. And a lot of the times that gets expressed in the question of, what's the best treatment option, So I think that these are really good questions, making sure you understand what the benefits are. Sometimes in healthcare, you've got like a 1 or 2% chance. Risks are really important too. There's nothing that's not without risks when you're involved in healthcare, whether it's pharmaceutical agents or whether it's surgical things or whatever. Asking if there are alternatives, and making sure that that kind of meets kind of what your goals and objectives are. What are the relative costs and the effects of waiting? I always share, whenever I think about this issue, I always share about how I broke my hand years ago, how I went into an orthopedic surgeon, and the orthopedic surgeon told me they could put a couple of screws in and plate or something like that, and be good as new. And I said, great. I said, so what are my other options? And the doctor said, well, you could just go with the soft cast that you got at the ER. I said, great. So if I went with that, what would be the difference between those two things? What would be the benefits and the risks of the two? And what the orthopedic surgeon told me is that I would recover without any noticeable difference, which is true. My right hand is just as good as my left hand. I have to see a little scar on my hand to know that which one had the surgery, right? He said the difference was that I would probably be able to recover about 2 weeks earlier if I had the screws in the plate, right? And so I asked him what the cost was. As I recall, it was $2,800 to $30,000. And also, as I recall, I was on an HSA plan since I've been on one of those for a long time. And I thought to myself, you know, I'd rather keep that money in my account, that $3,000 in my account to pay for my kids' braces, because I know that's coming down, and then, you know, have a little slower recovery. And so I think that this is important, and we'll just, you know, encourage you to realize that you are the customer, you are the client, you are the consumer, you are the patient, and you know, getting the answers that you need to make the best decisions is something that I hope we provide at PHP, and also something that you are able to experience as well with your providers. I'm going to briefly just kind of talk a little bit about some of our online tools for comparing costs. This is how you can compare medical costs. You can type something up, you can put the code in if you know that. You can look at popular searches, but this is exactly the part of the tool that I looked at when I gave you the example of the MRI. It's a back MRI. You can see that the amount is $333. You can use this for in-network purposes or out-of-network purposes, right? But you'd have to get the agreement on price if you went out of network. And you can see that the difference in cost between the office or clinic or the outpatient hospital. If you were to push the tab, and then you also have the possibility of cashback by calling us up and asking about that. And so you'd get $333, which is a good deal, and then there's a good chance you'd get maybe like $150 on this as well. Maybe it's $100. Then if you push that view button, it will tell you all of the freestanding imaging options that you'd have in order to be able to get this lower price, and also where you could get, you know, cash back on top of that. We have the same tool for prescriptions, and it works in the same way, except here what's cool is it will tell you what kind of benefit tier it's on, whether or not it requires pre-authorization. It'll give you the cost. And the way I look at this is that this puts on your plate the ability to ask your doctor about different options, you know. So in this case, you know, the one that you looked up is $6.68. And there's also this metformin, glipizide, hydrochloride, right, for like $100, you know. And so, you know, you'd have the ability to have that kind of discussion with your doctor. Our tool also allows you to figure out what the cost would be at your local pharmacies. Something that we're working on right now and hope to roll out to all of our groups is this new tool that would essentially simplify all of our cost tools and put it on a map, and would allow you to go in and put in what the category is, the subcategory is, push the button, and if you're on a star plan, it would show you where you could get cash back. And it would have a button at the bottom where it would just say, push this if you want to request cash back. And so my hope is that we can make something like this really, really simple for you to use. When you're on the star plan, you'd use this one. And the other thing we're working on doing is expanding copays for members that are on the traditional plan. And so again, rather than having to go through and figure things out, in this case, you know, maybe we have a knee repair that you know, might cost as much as $2,000 or something like that, or that MRI I was showing you before. And maybe for this knee repair, on a copay, you're looking at something between maybe $75 and $125 as a copay, right? Come before the deductible, just a straight amount. And then you know, you'd be able to see exactly where those places would be. We don't have a lot of these in the state, but again, it would give you the opportunity to see where these opportunities might be. But hopefully this will be really slick and really easy, and something that we'll be able to roll out here in the not too distant future. I just wanted to mention that the marketing group under Joel's leadership just does a terrific job of trying to take all kinds of issues and trying to simplify things and communicate things. We have some videos that are just really, really helpful, and we spent some time and effort to do that. And so we just encourage you to be aware of those and feel free to use them. I don't have a lot of time left, but I wanted to just emphasize a couple of things as part of our Healthy Utah program. Very proud of this program. Think it does great things for people. You know, we're able to help people in a variety of areas, including diabetes and weight management and emotional well-being and things like that. We've recently changed our rebates a little bit, and we still do the biometric testing that you know and love, but we're also requiring other wellness-related activities as part of that, to really help you engage and hopefully to help you find what works best for you. You know, I think we're all, maybe just because I'm getting older, you know, my health becomes more important to me. And when you find what works for you, man, it's just a really cool thing. And so we think that we've got a great program. We think that our webinars are great, our challenges, those kinds of things are really good. And so we want you to participate in those. Our next steps rebates will be essentially a little bit more of the same. And then we have targeted rebates for different conditions like diabetes, tobacco cessation, and We Care refers to expectant mothers. Also, just wanted to say one or two quick words on mental health. And my biggest takeaway on this is really, I'm not aware of any employer that doesn't have an employee assistance program. I would just underscore how important that is, that if you have any kind of challenging situation going on in your life and you feel you need a little bit of extra help, it's there, it's available for you. It comes under kind of that no cost sharing part of your benefit. And so just know that that's out there for you. As a health plan, we have a full range of services, including residential treatment. But in those situations, you know, we are looking at diagnosis. We have an online psychiatric service that we can connect you with if you're having a hard time getting to a psychiatrist. It's such a hard thing in Utah and around the country, and so this online psychiatric service is meant to try to import some help there. The state of Utah has this website. It's also something you can use on your phone, 211 Utah. If you, your family, or anybody else that you know are dealing with really difficult situations that need social services help, that's an outstanding resource. And then we also have nurse care managers or navigators within PHP that are just outstanding in terms of their ability to help in what can be some very challenging situations. I just want to mention one benefit that we're working with employers on, and it's a benefit that we started offering the state, and it's called a $4,000 infertility benefit. The purpose of this benefit is to pay $4,000 each time somebody has a single embryo that is implanted as part of IVF or assisted reproductive therapy or technology. The reason why we're offering this benefit is because we've learned through our experience that when you have only one embryo implanted at a time, it significantly reduces the chance of complications for the baby and the mom, which also saves a lot of money because a normal childbirth is maybe 11, 12,000. And when you look at complications, it's more like 130,000, right? So, so we know that people are paying a lot out of pocket for these services, and this is a way to try to encourage them to implant one embryo at a time. And so good benefit, important benefit. We're also working more with our employers in terms of autism. That's been a benefit that's been around for a while, and we think that there's a little bit more that we can do to expand coverage on that to more groups. I just wanted to share just one or two thoughts on COVID, mainly just to kind of let you see kind of what the COVID claims were like for us, where you can kind of see, you know, kind of in that December period where we went inside in the 2020, right? And people were having family gatherings, and then you can kind of see Delta. They kind of spiked it a little bit in September 21, and then you can see how Omicron just kind of came and went kind of quickly. We did have 728 hospitalizations at a cost of about $41,000 per. We had some challenges with processing claims during some of these periods, but the good news is that we've made some really good progress and some significant changes to improve our performance on that. Lastly, just want to say we truly see it as an honor to serve you. We really want to help you avoid surprises. We want to make sure you get the care you need. And maybe, again, just to underscore for us, we want to help preserve your benefits. You know, PHP, you know, we don't run this like a health plan in a normal sense. We just hold money for you. We get paid at admin cost. We have URS retirement benefits like you do. And after that, we just want to try to keep costs down because we know these benefits are important to you. And we want to make sure that that we help preserve those the best we can.